All right, today we're going to dive into an epidemic that honestly thrives in silence. It's one of the most common sexually transmitted infections on the planet. And the reason it's so common is because most people who have it, well, they don't even know they do. We're talking about chlamydia.
So let's just start with this number, 1.6 million. That's how many cases of chlamydia were officially reported in the US just in 2023. It's the most frequently reported STI in the country. But that word reported, that's really the key to this whole story. Because what if the real number is actually closer to double that? That's the whole mystery here. See, this infection's greatest strength is its ability to just hide in plain sight, often without causing any symptoms at all. And that means millions of people could be walking around infected with absolutely no idea. So let's break this down. What exactly is chlamydia, and why is its silence the most dangerous thing about it?
Okay, so at its core, chlamydia is a bacterial infection. The bacteria is called Chlamydia trachomatis, and it gets passed through sexual contact. We're talking vaginal, anal, and oral sex. But the defining feature, the one thing you really need to remember, is that it usually doesn't cause any symptoms, which makes it incredibly easy to pass on to someone else without ever knowing.
And this isn't just a US problem, not by a long shot. This is a massive global issue. Just look at these numbers. In 2020 alone, there were an estimated 128 million new cases around the world for people between 15 and 49. That really puts the scale of this silent epidemic into perspective, doesn't it?
So, if it isn't always silent, what are the clues, what are the symptoms that might actually show up?
Well, if symptoms do decide to make an appearance, it's usually about 1 to 4 weeks after you're infected. For men, it might be a pretty mild burning feeling when they pee or some clear or cloudy discharge. For women, it's even more sneaky. A lot of the time, there's nothing, but maybe, just maybe, some pelvic pain or a yellow discharge. You can see how easy it would be to just shrug these off or mistake them for something else.
And the infection doesn't always just stick to the genitals. Depending on the kind of contact, it can infect the rectum, which might cause some pain and discharge. You can even get a chlamydia infection in your throat from oral sex, which, surprise, usually has no symptoms. It can even spread to your eyes and cause pink eye or conjunctivitis. So here's the bottom line. We've talked about a few things that might happen, but the most common experience is nothing. No pain, no weird discharge, not a single sign that something is wrong. And that is exactly why just waiting for your body to give you a warning sign is a terrible strategy. And it's how chlamydia spreads so easily. And this is where that silence becomes truly dangerous. The fact that there are no early warnings can lead to some really serious long-term damage if the infection just sits there undetected and untreated.
For women, the fallout can be devastating. The bacteria can actually travel up into the reproductive organs and cause something called pelvic inflammatory disease, or PID. This is a serious infection that can scar the fallopian tubes, which skyrockets the risk of an ectopic pregnancy, and can even lead to permanent infertility and chronic, lifelong pain. And guys aren't off the hook either. If it's left untreated, the infection can spread to the tube at the back of the testicles, that's the epididymis, and cause a really painful condition. We're talking painful swelling, and in some cases, it could even affect fertility. It can also cause scarring that narrows the urethra. And the damage isn't just reproductive. For some people, a chlamydia infection can trigger something called reactive arthritis, which means painful, swollen joints. And if a pregnant person has it, they can pass the bacteria to their baby during birth, which can cause serious eye infections or even pneumonia in the newborn. So with a silent infection that can cause all these hidden dangers, how in the world do you find out for sure? How do you get a clear answer? Thankfully, and this is great news, finding out is actually incredibly simple and accurate. The best test we have is called a NAAT. It's super sensitive, and all it takes is a simple urine sample or a quick swab. So it's really easy and non-invasive to get a rock-solid answer. This quote here from the MSD manual just nails the whole public health strategy. The logic is so simple. Because the infection is everywhere and it's so often silent, you just can't afford to wait for symptoms to show up. The only way to catch it early is through proactive screening. So, who should be getting screened? Well, the guidelines are pretty clear. They recommend annual screening for all sexually active women under 25 and for all pregnant people. Men who have sex with men should also get screened at least once a year, maybe more often if their risk is higher. For other guys, it's not considered routine, but you can always ask for a test. Okay, this brings us to the end game. What happens if you're diagnosed?
And even more important, how can you keep yourself safe in the first place?
And here is the absolute best news of all. Despite all the serious risks we've talked about, chlamydia is completely 100% curable. It's treated with a short, simple course of antibiotics. The infection can be totally knocked out of your system.
Now, for the cure to actually work, there are a few rules you gotta follow, and they're non-negotiable. First, you have to take every single pill you're prescribed. Second, and this is so important, all of your recent sexual partners have to get tested and treated too. If they don't, you'll just keep passing the infection back and forth. And finally, no sex for at least a week after you finish your treatment, just to be sure it's gone.
Of course, the best strategy is prevention, right? And it really boils down to 3 key things. Step 1, practice safer sex, and that means using condoms the right way every time. Step 2, reducing your number of sexual partners lowers your risk of exposure. And step 3, if you're in one of those groups we just talked about, get screened regularly.
So we'll just leave you with this question. Chlamydia is silent. That means you can't rely on feeling sick or seeing symptoms to know what's going on with your body. Knowing that, it really puts the power and the responsibility right back in your hands. So, what's your plan to stay informed and be proactive about your health?